if you just were to repeal and not replace. That's the worst case scenario, Kate. Just repeal and not replace. Congress not able to...
No plan in place.
No plan in place, with Congress not able to come up with a plan. You're talking about 18 million more people uninsured in the first year, 27 million more in the third year, and by the end of the decade, 32 million more. The reason why is because you would have no individual mandate. That is sort of the core, the backbone of the current law, Obamacare. That means people would just be able to leave. Healthy people would be able to leave. And when healthy people leave, and maybe they're uninsured on their own volition, but they leave, then you have sicker and more expensive people in, and that pushes up premiums. That means insurers charge more for the rest of us who are in the system. So 20% spike in premiums in the first year, all the way up to doubling by the end of the decade. So that is the concern there. A second part of this concern here is this sort of idea you're hearing from some conservatives that if you repealed now and then gave Congress a deadline, a 2-year deadline, leave Obamacare care in place, and then in 2 years, insurers will know that there's some new law they'll come up with. There's too much uncertainty in that. It's very hard to tell what that would mean for consumers in the near term. And markets, in fact, if you look at this, if you look at the dollar here just today, it has been sinking, because there's this feeling that if the president, with all of this effort, the art of the deal president couldn't get this through, what does that mean about tax reform? What does it mean about infrastructure? What does it mean about some of the other important things that were really enthusiastically greeted by the business community? So the first kind of ding we're seeing in the hopes that this art of the deal president will be able to get a deal on health care or anything.